This episode of the Oral Health Podcast is brought to you by the Wrigley Oral Healthcare Programme. We'll link all of their information in the description below. Hello and welcome to the Oral Health Podcast. So in connection with National Smile Month, we are bringing you bite-sized discussions from different people in dentistry about oral health and a wide variety of topics. So today we are going to sit and have a chat about oral health in the workplace, how it fits in not just office life, but everyday working life. And I am very, very lucky to be joined by the Senior Principal Scientist for Mars Wrigley, Michael Dodds. How are you?
I'm very well, thank you, Sophie. How are you?
I am brilliant, yeah. Well, we're putting up with the miserable weather, but that's fine. We can do nothing about that, so we're plodding on. And so let's discuss oral health in the workplace. I know a lot of us have been working from home because of the global situation over the last year or so, but it seems like temptation is everywhere in offices where it's always someone's birthday. There's canteens that are full of bad foods, and every now and again, with the best will of the world, we do forget to brush teeth in the morning and don't realise till we're in the car, and we've all done it. But is there anything that you would say about oral health in the workplace just off the bat?
Yeah, I as you say, Sophie, yeah, I mean, there are temptations and people bring in with the best intent in the world. Oh, it's Friday. I'm going to bring in some donuts and cakes today to celebrate Friday. And those temptations are there. And I think we have to be very careful. You know, it's easy in the office to slide into that. And it's okay to snack occasionally, but we have to keep our oral care routine. So you mentioned forgetting to brush in the morning. We want to brush twice a day. You may not be able to brush while you're in the office, but if you've had a sugary snack, if you've had some coffee or tea with sugar in it, then the sugars can start to cause decay very early. Acid in the dental plaques can start to cause decay, and you can offset that by doing something that's fairly simple. I mean, I keep chewing gum, sugar-free chewing gum by my desk all the time, whether I'm working from home or in the office, and I'll pop a piece if I had some coffee or if I had a snack, because we all need to take breaks in a day, and I think this is one way to do this.
Is there anything that people could bring into the office to have that Celebrate Friday feeling that isn't a sugary snack or a donut? What are some oral health friendly snacks that people could turn to instead?
Well, I mean, it's one possibility is just to bring an option for some a fruit plate or something. That would be a nice thing to do. Sometimes there are nice displays of fruit available in the supermarkets if it has to be something like that. And then of course it's easy when you have the bottles of the containers of chewing gum like I keep at my desk. I mean, you can spread these around when it's okay. Well, now we've had this, we can go back to work. Don't forget to pop a piece of gum to help you sort of refresh your mouth and get rid of the some of the acids that could be caused starting decay. So I would say healthy fruits, nice displays of fruits would be one way to do this. And sugar is very much a treat, but you have to restrict how often during the day you do it.
Yeah. We're never going to get people to never, ever have sugar. It's just about the limitations and the everything in moderation attitude, really, isn't it?
Exactly. And the grazing culture is a concern that we all fall into, because 3 square meals a day is one thing, but when we're at work, whether at home or the office, then it's easy just to pick up something, bite into something, have sugar in your tea and coffee and keep sipping it. And that's the problem, is that frequency. So if you could compress it into fewer events during the day, it'd be a lot better for us. And oral health, I think, is not really as well recognized by our employers as a concern as well. I mean, I think they may be a little bit more emphasis by the employers on the importance of, employers want a healthy workforce. It's important for their productivity, and there are concerns about people losing time through general health issues, but oral health is part of your health as well. So making allowance for that would be important in the workplace as well.
Well, what kind of allowances do you think employers could maybe look to make in the workplace?
A lot of employees now, and I speak as a dentist
Mm-hmm.
who doesn't practice. I work in an office environment, and so increasingly I see that employers are offering health packages that emphasize wellness programs of various kinds. And I can use my example is that I can track my steps every day. I can track my sleep patterns.
Mm-hmm.
I can track all sorts of things. But guess what? My oral care isn't included in that tracking. So I think just recognizing the importance of that, recognizing that there is significant loss of work through dental problems, and we see that people take unexpected days off work because of dental problems
Mm-hmm.
that could be avoided by just taking an hour or two during the year to have a routine dental visit and a checkup, because particularly with the pandemic, people have been avoiding this kind of routine dental treatment, dental visits. And there is a concern that there's going to be a surge of dental problems as a result of people avoiding visiting dentists and
Mm-hmm.
hygienists.
Yeah, no, definitely. And talking about them trackers, you can download things that allow you to track your food intake. It might even
Mm-hmm.
be worth encouraging people to maybe download something like that and then go, oh, make sure you look at your sugar intake and it shouldn't be over this much, and make people a little bit more aware of where their sugars are coming from. And because I know when I used to work in an office, I thought I was being really healthy and I'd have dry cereal next to me that I would snack on, but that is coated in sugar. But I thought because I
Mm-hmm.
wasn't eating chocolate, I was all right. That's just not true.
Mm-hmm.
But people need to maybe be a little bit more aware about where all the bad stuff, quote unquote, bad stuff is coming from.
Yes, exactly. And I think that's a great point, Sophie. I mean, the hidden sugars you just don't know about, and you're thinking you're doing something good, and tracking them would be a great way to do it. And the other thing, I think that a recognition that it's not just about your teeth.
Mm-hmm.
Oral health is part of good health, and the associations between poor oral health and conditions like diabetes, heart conditions. And there's even some research coming out suggesting that COVID infections in the lungs are actually not through inhalation, but through blood vessels around about the teeth and gums that are inflamed, letting the virus get to the lungs.
Yeah, definitely. We had Dr. Angela on a few episodes ago where she did a really good job of explaining systemic diseases and how the mouth is connected to the whole body. So if you haven't heard that already, I really do recommend you go back and give that a listen.
So there's all the more reason for keeping your teeth clean, for brushing regularly, and ensuring you follow a healthy snacking patterns.
So yeah, I think you've hit the nail on the head there of just think of it as more than your teeth. Think of it as
Mhm.
your health. Yeah, you value your health, so you need to value your oral health as well.
And it's silent. You don't know. I mean, yes, people you might have a toothache, which is that happens to people, but at the same time, some you just don't know. It's insidious that something's that's gone awry in
Mm-hmm.
your mouth, and unless you've seen a dentist or visit the hygienist, they're trained to be able to spot these things, and they can also pick up other associations with systemic diseases that could be there too. So
Mm-hmm.
it is super important. I mean, people are still reluctant to go back to dentists, but at the same time, also it's difficult to get an appointment, even if
Mm-hmm.
you do want to go. I understand that there's a backlog of treatment needs through the dental practices being closed down for a while. So all the more reason. And then, of course, I would say that sometimes it's difficult with the best intent in the world for people to get time off work to go and visit a
Mm-hmm.
dentist. So for that, look around. There may be practices open out of hours that are outside the regular working hours, Saturday
Yeah.
mornings in some cases, or evenings. So that's a way to do it. But if employers were able to offer flexibility and say, well, if you've got an employee who is ill, you would say, well, go home, take some time off. Why not give them the time to say, I need my routine checkup today. Can I have a couple of hours off work? And they should, there should be some flexibility to allow that to happen.
Yeah. And as well, if you're talking about maybe non-traditional clinic hours in being available in some practices, there's a point in there as well for people that don't have traditional like 9 to 5 desk jobs, like say lorry drivers and people that are out and about all the time. That as well, I suppose, with things like sugar-free gum, that's a very easy thing to make sure that you're cleansing all them bacteria and acids and things out of your mouth when you cannot physically get to a bathroom and brush your teeth. If your job means you're either on your feet all day or you're out and about all day in a car, or maybe like in a hospital, or something where you're going to be very, very busy, it is something that you can do yourself.
You do on the go. I mean, absolutely. It's I brush my teeth. You brush your teeth typically in your bathroom at home, and morning and night. Maybe you might happen, if you're lucky to live to work in an office and have the availability to have a toothbrush there and use it during the day. That's fine, but many people don't have that. So it's not a replacement for brushing your teeth, but it is a way to help cleanse, as you say, Sophie, cleanse the sugars and neutralize any acids that's starting to form in your mouth. So just pop a piece of sugar-free gum and chew it for 20 minutes, and you will refresh your mouth and wash away a lot of the sugars and some of the acids that could start to cause decay.
Mm-hmm. Something that I've been wondering, when we were preparing to sit down and talk to you and talk about oral health and the work, and I wonder, because obviously as we start to get back into offices or workplaces more, and now that home working may hopefully be eased off and we're going back into traditional workplaces, if COVID restrictions carrying over into workplaces and everyone being conscious and safe, that could possibly have a really good impact on oral health, because people aren't going to be crowding around snack tables or making each other drinks. And what do you think about that?
I think that's an excellent point. I mean, I think one of the things that certainly we've seen in consumers and the public in general is an increased awareness of cleanliness and immune health, and maybe just avoiding gathering together too much, and that could certainly be an opportunity to think about it. One of the things that's happened as well is people getting tested for COVID, and there's nobody likes having a swab jammed up the back of their nose to get a test, but there are saliva tests now that allow you to do that. So recognizing that the mouth is something that is a way you can monitor health, as well as just thinking about keeping your teeth clean. I mean, there's a lot of positives there, and saliva in your mouth that is we don't even think about. The only time we think about it is when we don't have it. But it's super important to helping keep not only your mouth healthy, and it helps you speak, it helps you eat, chew, swallow, and protects you from infections, bacteria, and viruses, and anything to stimulate that can actually help to just reduce the overall load of and burden of bacteria you've got in your mouth. Everybody's got bacteria, but you can help reduce the amount of those just in general by just keeping things moving, keeping fluid flowing, which is saliva. And that's what happens when you chew. It's just very, very healthy.
Saliva, really, it's one of them things that when you sit and think about it, you realize how amazing the human body is. The fact that it can do so much for you and you don't think about it. It's normal to not think about, but when you do think about it, you go, oh, actually, that's really, really cool.
Well, it absolutely is. And people don't think about it until they don't have it. And if you don't have enough, if you have a dry mouth for whatever reason, certain medications, these sorts of things can cause a dry mouth. It's uncomfortable. And but I call saliva nature's healing fluid. It protects, it heals, it bathes. And it's in the mouth, it's protecting in the teeth to a great extent, but it's coating the upper part of the throat as you go down to the stomach, the nasal passages. There's a lot of immune function in there, sort of certain kinds of proteins that protect against bacteria. Immune function is there as well. So it's doing a lot, and we don't recognize it, and it's just spit, but it really is something that has a function. It's there for a purpose, and it's when we don't have enough that people do have a lot of problems with other issues. it really is a very miserable situation having treating patients with dry mouth.
I like that though, nature's healing fluid. I like that. I'm going to remember that. But just to bring it very quickly before we come to an end about oral health at work, if you were to give, say, an employer and an employee 2 bits of advice for taking care of oral health at work, what would they be?
Oh, okay, so I would say to the employee, just be aware of your snacking patterns and think about how you can limit those and snack healthfully, but also if treat yourself. But if you do, think about popping some chewing gum afterwards. And I think for the employers as well, I think awareness, understanding that. By encouraging oral health as part of overall health programs, you get a better, healthier, more productive workforce that are less likely to lose time through various forms of ill health, including unplanned dental trips that could lead to missing a whole day instead of just an hour to have a dental visit.
Mm-hmm.
Whether there are employers offering dental health programs, I don't know, but certainly it is an option for some benefits packages that are offered, and I would certainly highly recommend that people look at those. But I really think that at work health programs should include, there's stress reduction, there's yoga, there's all sorts of other things going on, and just an oral health minute is an easy thing to do.
Mm-hmm. Definitely. Well, Michael, it has been absolutely fantastic talking to you. I definitely feel like I've learned a lot, so I hope listeners do as well. Yeah, it's been really good, really informative. Thank you so much for coming and talking to me. And yeah, it's been great.
Well, thank you, Sophie. It's been my pleasure, and I hope that people get some take home some useful information.
Absolutely.